So there are many different ways in which you can go about achieving patient identity. You could look at the criteria of how do you go about achieving identity under what I would refer to as the NIST level of assurance. There are different levels of assurance. In healthcare, obviously we want to follow the ONC's guidance to achieve the proper level of confidence relative to identity. We're looking for a NIST level of assurance 3. And that has some specific criteria. And you can look at the criteria and say, yeah, all of our processes and procedures relative to doing patient identity is in line with that criteria. However, doing so without any credentials or review process puts credibility at risk. So what we're recommending is to do that under an ENAC type of registration authority type of model, where there's a chain of trust established through the registered or the credentialed registration authority all the way down to the hospital system. And this is a very similar model that all the hospitals are engaged in relative to meaningful use stage 2, transitions of care, and direct messaging. It's the exact same type of registration authority. We're just now applying it to the patient side of the equation versus the physician side of the equation. So again, ENAC accreditation registration authority, following that same criteria, gives you credibility as an organization that says, I identity proof this person at a NIST level of assurance 3, again, under those credentials. Again, it gives the whole process the credibility to move it forward. So in today's healthcare system, we know that there are 3 primary elements that impact data quality. We have, on one hand, duplicate records. We have, and on average, 8 to 12% in an average EHR. It doesn't matter which EHR, but on average, 8 to 12% of all medical records are duplicates. We have medical identity theft, which says someone's coming into my healthcare system using somebody else's data and replicating another person, and that data ultimately gets hypothetically merged into one, so the data is now corrupted. So we have duplicate records, corrupted data, and then we have more so on the payment side of the equation, payment fraud. So what we need to do is look at how we address data quality by addressing those 3 problems. And I would also argue that you need to address those 3 problems as well if we're going to move from an encounter-based system to a value-based system. Ultimately, it comes down to knowing the patient. Who is that patient? We talked earlier about patient identity. And so if I can identify that person and match that person to a specific record, then I know with confidence that every time they come into the healthcare system, or every time that the data is exchanged through transitions of care and they use the same construct and the same identifier, that we know that when those 2 data records merge, that it is deterministically established that it is the same patient, and then therefore connected to each other. So understanding how we can address duplicate records, medical identity theft, and payment fraud simply, I should say simply, but simply by establishing a unique health safety identifier within the healthcare ecosystem. So probabilistic matching versus deterministic matching. Probabilistic matching is typically the methodology used within an EMPI, an Enterprise Master Patient Index construct. It takes a string of data fields and strings them all together and tries to match that string against an existing string within a data record and tries to determine whether or not it's the same person. That's probabilistic. And with an EMPI, with the data at its purest, and we all know within an EHR there's many challenges relative to purity of the data in and of itself. But if the data was at its purest, an EMPI can only be effective at 98% of the time based on studies. So you'll never get 100% data matching using an EMPI model. Deterministic matching is based on a very specific representation of that patient or that record. It is, as we talk about a unique health safety identifier, that's a very specific reference to a person. Now, that identifier is matched to every record associated with that patient. So it's so it's one field. They either match or it doesn't match, and if they don't match, it's not the same person. So you can't merge that record or connect those two records together. So probabilistic matching is very much challenged relative to today's model. And it's going to be even more challenging to lead that model as it stands as we move to a value-based care model, because we need to know exactly how many managed lives we have in our healthcare system. And the only way that you're going to be able to do that efficiently and with high level of confidence is to have a unique health safety identifier matched to that patient. One patient, one identifier, one record.